రావట్లేదు క్లబ్ హౌస్. Hello, everybody. Okay. Good evening. Welcome to my room. This morning I was in a room, not this morning, this afternoon. This room was planned this morning, but later on, fortunately, I went to this room. They were talking about what kind of monitoring. Hi, Rene. Welcome. They were talking about what kind of monitoring is possible, how best this external devices and data from it will help us to maintain our health and all that. I personally think there's a personalized medicine that is developed, and more people are getting into monitoring their own health. I think that's a very good thing. But even before that, I was questioning about how many people are really conscious about their state of health or what's going on in the body, how much response they are giving to the indications. For example, some people may feel fatigue, may not be able to climb the stairs, may be having difficulty breathing, and they push it, and then they kind of worsen their whatever underlying thing going on. Many people with older people, especially with shortness of breath, heart failure, that we detected, but they kind of push it. They kind of want to get on with it. But young people also, they don't pay attention to simple things like they're having fever occasionally, or they're having too many sore throats, or they are having cough, congestion, something like that, and they have been in the polluted areas, but they don't really pay much attention to the messages that their own body and mind is telling them. I'm saying that you be paying your natural inclinations, natural messages of the body from your body clock. That if you are going excessive hungry or thirsty and all those, you pay attention to that, and that will be not in an obsessive compulsive way, but more like a smart try to prevent it when they are very small. Get it checked, get it fixed, like that. So that kind of sense of responsibility is not seen even in the people who are well educated. They kind of they have the insurance, they have the facilities, they have all the amenities, but they don't have the time. They have some work project or something that's more important than their health. That's what I'm saying is go get the devices, follow, monitor your health. That's fine. But then before cultivate this, then you may not even need those devices because you are responding to your regular diurnal rhythms, we call them, right? And if you can pay attention to that, like you are eating when you're hungry, and you are kind to drink water, not to the degree when you're thirsty, but even before you're thirsty, you sip the water once in a while. And also, you kind of rest when the body is telling you that I'm already tired out, I cannot have any more energy to go forward. Then you have to listen to it, and then so basically listen to the body. If that is not there, then all the monitoring, everything also probably will delegate the same drill to them like you are doing it now. They say it is the doctor's responsibility, it is the system responsibility to keep us well, but I will do whatever I want. So I will eat this junk food, I'll smoke, I will not rest, I will spend late nights unnecessarily, all those things, right? So simple health principles. One of the most important one is listen to your body signals, and then pay attention to all the data, use all the supply of help that you want. That's fine. So in this room, I want to bring to people's notice whether they are really being smart as far as their health and wellness are concerned. That means, are they knowing what their family health is? Are they really examining what they are eating, what they are moving, how they are sleeping, how they're resting, how they're keeping their mind. All these pillars of wellness, are they paying attention to them? So that is being smart, not waiting for problems to become so bad that you cannot really cure them, right? Don't be like that. That's what I was always bringing notice to. And my patients, for example, when they come, they may come for a simple thing like having sore throat in the season, or they're having too much cough, or they may have blood sugar problems, blood pressure problems, cholesterol problems, or arthritis, any number of problems they come, right? Whatever the problem they come, I usually take a real good look at their overall health, how they are doing with their blood workup and all of that. Whether there's anything indicated last time, and we told them some measures they should be doing. For example, if you have a very high cholesterol, I may have told you about some things. I might have put you on the medication. But now, when we check it, we say, okay, we are checking it to see how the progress these interventions made, that kind of thing. Okay, so people think, "Oh, we pay attention to this," but if you really pay attention to your body signals, you don't have to monitor so much because body monitors very well. And then, unless something goes very wrong, you will be having a very well, energetic, joyful life. Okay, so that's where I focus on people paying attention to their regular routines, their regular energy, their regular depth of sleep, or their good appetite, working out and going and eating after a good appetite. That kind of simple things, if you listen to, you are better off down the line. Okay, that's what I was going to talk about in this hour, where normally what's happening is government determines certain preventive standards and certain scales and schedules. Like somebody who is after 50, they should have a colonoscopy done, and that should be done every 5 years. But in between, you have warning about rectal bleeding and too much of appetite change or bowel movement change. Then something is going on in the gut. Okay, that's the message body is sending you. So you don't wait for the 5 years. You just go and check it out now. That is the standard these days. We kind of we can do scope even with giving a pill. Once you swallow the pill, then we can take the picture through the pill, and then as the pill comes out, and then we have all these photographies that were generated by it, and by assembling them all together in the computer, we can see like we are seeing in the colonoscope. So that kind of non-invasive measures are available for you. You have a complete colonoscopy. That's also pretty well done, easily done, outpatient. So people get much better diagnosis these days than before, right? So take advantage of things like that. But you have to have this awareness that this could be something deeper than what we thought. So these non-invasive measures are here, so we can easily get them done. So that is being smart about any conditions, or how to identify the conditions in a very early stage and then cure them and then treat them, right? So that is the aim. And towards that, there's so much happening in the medical field for the personalized medicine. We have apps, we have a lot of devices that can help you to monitor your health better and give you much more information about what's going on, and then take proactive action so that things won't become really a big problem. Okay, that's what I was going to focus on today. If anybody has individual stories or concerns, you can come and talk to us, and I'll be more than happy to answer your questions. Okay. uh, it's got the way everybody's talking about data and all that, but at an ordinary patient level, they may not want to be burdened with all the data. They may not even know how to interpret the data. That's also our job, to interpret and educate them so that they learn and they react to whenever they see something like flags. Some red flags will come up, right? Then they know how to act on. One of the best parameters for that is listen to your body. Okay, Once you listen to the body, body will tell you where you are going, what you are doing. Okay, like for example, you have some back pain, and you don't know what is happening, but you have been prolonged sitting in the chair, and you don't know how to relieve that, then you will be having the back pain worsen, right? Suppose you get up and walk every 10 minutes, and that becomes much easier to handle that. Okay, so those kind of simple things make a lot of change within you. Okay, so just paying attention to what we are doing, what's happening when we are doing to our body and mind, and how we can really go and have them checked either by our own devices, like now we're having these apps and devices, or we can go to a regular medical center and they get you checked and then act accordingly, right? So that is smart. So be aware of where you are, what is happening in a daily, what's happening when you're resting, what's happening when you're out on the job, or what's happening when you're exercising, what's happening when you're really exerting your mind and body, how much stress you are able to take, and what is the effect of the stress on you. All these subtle things, if you pay attention to, but sacrificing that at the excuse of I'm busy, I don't have time, I have to do these things. I think that is kind of not being very smart in my dictionary. So take care of yourself, fix yourself, and then go about whatever you are trying to contribute, whatever you're trying to help, whatever you're going to serve, to whatever system you're in, right? Uh, Sometimes you may not be in a position to do that. The other people are bossing over your life. So that is too bad. Then you may even want to consider changing the jobs to protect your health and wellness. If that's all not possible, also, then you can use your regular time to identify what's going on. Now you have artificial intelligence, now have chat GPT, and they can give you a lot more information, right? It is okay to search for it, but then be careful what you are doing, and then go to the reputable medical journals and verify it. It will be okay, right? But lots of times it is depends upon what you are trying to ask, and the generative AI will generate the answers for you, and that are pretty much research too. Nowadays, you can have um, something like perplexity, which will go through the web and give you the references, or you can have web gpt in the chat gpt, and that will also go through some references and give you. Maybe it is restricted to 21, but the bard and bing, all this, they have much more access to the internet and give you the data too. Okay, so what I am saying is, first start to listen to your body, do the regular health principles, and then if there's something wrong, then use the apps or devices, and then you can also seek the medical advice at the time. And the idea is to catch things very early and fix them, so that they don't become a big deal because of our negligence. But don't have to live in fear. We have these facilities, we have this level of awareness, so we have to use that to be smart about our health and wellness. That's what I'm saying. Okay, so usually the system is such that then when you are sick, they will do all the things for you, and then they also make money. So they want you to get sick so that they can make money. But wellness people are those who say, I want them not to come to me for the help, so they can help themselves. That is the kind of. So there was a famous saying: a good surgeon is one who try to prevent surgery at all costs. That means he could allow the patient to develop certain measures before surgery, and if it doesn't help, then you do surgery. So usually it's a last resort for the surgery. There are conditions where you have to do it right away. There are conditions where you can buy some time and have the medical treatment, and then have the surgery. Okay, but first you avoid surgery because you don't have to go through the post-operative period and the coping and all those things, right? Some people heal well, some people don't heal well. There are so many things out there, so it's better to not to have surgery if you can help it. That is being smart. Okay, be smart with your health and wellness means be more responsible to your health and wellness. Be conscious of what is happening with you, and always be proactive. Preventative is not enough anymore. You can be proactive. You can understand these things. Even the genome we can do, and we can tell you what is stage of genome you are, what is the possible impending illnesses you have just from the genome, right? So 10 years down the line, we can predict what are going to have. So in this day and age, being aware, being focusing on the proactive wellness measures is the smart thing. But if you allow these things to go on, they will lead to something much more expensive and much more costly for your quality of life and all that. Okay, so don't lose the health and wellness so that you will regret that you have done it and it's taking forever. It's never coming back to the original state. So health once is lost, that is kind of very difficult to do that. You need much more discipline, much more orientation towards wellness and all that. Okay, so that is what I wanted to say for this evening. Hopefully that made some sense for you. And if anybody have any questions, DM me if you have. I'm sure this is just not a big topic, just to bringing kind of awareness to the health or wellness problem. Many men don't come for checkup on their own. They have to be brought in by their wives or sisters or mothers. So usually they neglect it. They say, I will be fine. I don't have. I'm not talking about that. I'm talking about just be commonsensical and sensible about these things. And then, if you are smoking, for example, and then you have addiction of it, and then but you are developing a lot of cough and infections on and off, and then you are also having some difficulty breathing, it is time for you to get checked and then get away from the smoking. And there are so many measures we do to get you off the smoking, right? But many people don't want to do that. They think they will be okay without it, but unfortunately, they will come very late. Even for the CT scan, sometimes it could be late. So, but these days, genome is making rapid progress on that. They can see whether you are aging quickly or not. So we can tell you what is your biological age and what is your physiological age and all that. There also you can know I'm aging much more than my age, and then these are the mistakes I'm doing. Then you can reverse that by changing the behaviors. So for so many reasons, it is smart to be paying attention to what is happening to the body, what is happening to the mind, without identifying I'm this body, I'm this mind. Then you will be in that philosophical area where you are identifying with your life, not just the body and mind that are having the life because of the life is there. Okay, once you focus on that, then you can take care of the things much easier. The things are body and the mind. Okay. All right, so that's what I wanted to speak about today, and I'll be seeing you again tomorrow at the same hour. Okay, bye bye.